Hi, good evening, Dr. Sita.
Hi everyone, welcome to our new live talk show, Health Talks. Today is our first show on Health Talks. I would like to invite my guest and co host, Dr. M.S. Kanwar, Senior Consultant and Advisor, Lead Lung Transplant Program from Apollo Hospital, one of the best hospitals in India. And he has been supporting us all the time during the time of COVID. So we are really thankful to him. So, with this, I would like to invite my co host and my guest, Dr. Kanwar. Hello, Dr. Kanwar, how are you?
Hi, Rashmi. Thanks a lot. And thanks for inviting me to be a co host. It's a privilege and a pleasure. You guys are doing a great job. I mean, I've been with you for the last 6 months now, probably.
Yeah, Dr.
And
Kanwar.
uh, we will, in this new talk show, we will be discussing some of the latest and new subjects, and some of the things which are kind of so close to the heart of the public, and they want to know more details. And that's all regarding their health matters. So we also go a little bit deeper into the subject to enhance the understanding of our viewers who are interested in some more information and details. And we'll ensure that our guests will be experts with a lot of experience to share with our viewers. And of course, we'll have a live question answer towards the end of the show. We'll hopefully be covering this within 45 minutes. And we will have a tremendous kind of exchange of knowledge, let's say, and expert guidance on a lot of issues, especially regarding COVID, which is such a worrisome issue at the moment and has been for the last 6 months. Rashmi, you wanted to ask me something about the COVID,
Of course.
current
And
COVID
firstly, I would
status.
like to thank you, Dr. Kanwar. You are in India and you are helping people worldwide. And you're sharing your knowledge and you're giving your services to the people. It's really great. And a big salute to all our doctors. Thank you so much. And viewers, every Wednesday, 10:30 a.m. is the time for health talk. So stay tuned. And every week we'll be having this show. And Dr. Kanwar will be with us. And thank you so much, Dr. Kanwar. So, Dr. Kanwar, I would really like to know अभी क्या स्थिति चल रही है इंडिया में बिकॉज इट्स रियली गोइंग क्रेजी और यूएस में भी अब थोड़ा स्केल ग्राफ इज गोइंग डाउन बट a little bit awareness is there but इंडिया में भी मैंने देखा कि थोड़ा ये स्प्रेड हो रहा है सो हाउ इज इट नाउ एंड व्हाट इज इट
Actually, Rashmi, what has happened is wherever the fire has already burnt the grass, it is cooling off. But the virgin areas are the ones which are being attacked by the virus. So it has to spread, and whether it goes slow or it goes fast. And the very idea of lockdowns in the beginning, all over the world actually, was to slow down the pace of the virus, not that it was going to kind of save the people entirely from the virus. That probably was to some extent possible in New Zealand. So let's keep New Zealand aside. Rest of the world could not stop the growth and spread of the virus. But having lockdowns and a very kind of robust policies and advisories regarding the staying away at least 2 meters, using the face mask and using the hand hygiene all the time, washing the hands so frequently the whole day. That is what has helped slow down the pace. That has helped us in the hospitals all over the world to cope up with what could have been a major disaster in the form of lots and lots of very sick people coming in. And we in our hospitals wouldn't have had the capacity to take in those patients bed wise, in ICU wise, or in the form of ventilatory managements. We would have been overwhelmed in all those situations, and even the PPEs would not have been in place in a lot of places if the the cases would have just swarmed the hospitals in the beginning. So
Absolutely.
that was it. But the in India, as you've asked, the disease was rampant in Mumbai and Delhi, but it is slowed down a lot in Mumbai, and so it has in Delhi also. But it has gone to so many other states and even the interior into the villages. So it is spreading there, and I hope in those places, the kind of control measures and the containment measures, they are well in place, and they're following some kind of model because they've seen the experience of other places. So they have something to go by rather than be doing things blindly. So if they follow those things strictly, and the states, the governments, they are strictly on the vigil, then probably a containment could be in sight within a couple of months. Same has been the state in USA also. In New York, for example, it was like a wildfire,
Mhm.
but it's cooled off there. Florida, and now the western state, the California, Arizona, and those areas are getting affected now. So now the numbers, I mean, look where we started from, and now the numbers across the world of the infected people have crossed 20 lakh, 20 millions,
Yeah.
20 million. And the mortality has already been more than 740,000
Mhm.
worldwide. In India, the deaths have been something like 46,000, and we have something like uh, 23 lakhs, 2.3 million people already affected. So it's a huge, enormous calamity, and we are dealing with that, as best as we can. And our in our hospitals, in the tertiary care hospitals, I think we are much better off than what we were 5 months earlier, and we can handle the patient so much better. And our mortality figures are certainly going down, over the last couple of months. So fewer deaths, more numbers of cases, because we are doing a lot of antibody tests also. The numbers are much more, but the mortality rates are less. So a mortality rate which was worldwide somewhere around 6%, and even as high as 14%, 14 point some percent in Italy and Spain,
Mhm.
and also very high 10% plus in the UK, has been hovering around for a long time, around 3.3% in India, but it has come down of late to 2%, largely because of more and more antibody tests, means milder cases are being picked. Those who would not have otherwise probably even come for a testing or approach the hospitals or the clinics. So they are being picked up. And so we know now that in the milder form, the disease is rampant, but it's not been picked up. So if you include all those numbers who have been so mild, then and then look at the mortality figure, then obviously the fatality rate is coming down. I won't be surprised if it comes down to 1 or 1.5% sometime in the future.
Absolutely. And I think so. A lockdown is the best way to be. But lockdown is
Yeah,
not the answer because it's affecting our economy also. And people are
yeah,
getting frustrated. They are really tired. It's pretty long now. Like, they are
absolutely.
looking
Even
forward for the vaccine now. Yeah.
even in India, we see people on the roads in the shopping centers. They are now feeling more free. Eventually, they are so fed up being within their homes, and they have now come to realize that the mortality is not as big. So the fear factor has gone down. So apparently, that has been the result of all this confinement, lockdowns, and staying within the homes, and the life becoming so terribly boring for them,
Of
frustrating.
course, of course.
But anyway, today we are here for vaccines, and we have an expert, no better person than Dr. Sita Naik with us, who has been an immunologist, and he started the Department of Immunology in the SGPGI Lucknow way back in the year 1987, when people did not know much of immunology, and they would have thought, why is she going in for a separate department for immunology? I'm sure she would have had a struggle at her hands, because whenever we start something new, there is a whole lot of resistance. But she came through so very well and headed the department, and eventually later on she became the dean of the SGPGI, and so she'll be talking to us about the current status of vaccine, immunology, and whatever she can explain in easy lay terms to a lay audience. So we would welcome Dr. Sita Naik to
Welcome
our
to the
first
show,
show.
doctor.
And Rashmi, I'll also like to introduce you that she is also one of the authors in the book that we are involved in writing on COVID-19. So it's my pleasure to have her as the first person among all the authors to be on your show. Welcome, Dr. Sita.
Welcome
Thank
to
you,
the show,
Rashmi,
doctor.
and thank you, Dr. Kanwar. It's a pleasure. Thank you for inviting me to be on this program. Thank you.
Uh, Dr. Sita, let's start with just give us an idea about what is basically body's immunity. So we're talking about immunity, vaccination all the time, but let the lay audience try to understand what what an immunity of the body really means, and how does it change our lives.
Um, the immune system is unlike any of the other organ systems of the body. It's not limited by a set of organs like a heart or a lung or a liver. Uh, it consists of these large number of cells distributed very widely all over the body, because the basic function of the immune system is to recognize anything entering from outside and eliminate it. So in this context, it might be a whole lot of things, but predominantly these are the pathogenic organisms, viruses, bacteria, parasites, which are foreign to us and which, when they get into us, they can cause disease. So the immune system has mechanisms to recognize foreignness and distinguish it from our own tissues. And every time it comes across something that's foreign, it mounts what we call an immune response. This immune response has two distinct phases. The first phase is what we call the innate immunity. And this is a very simple first line defense. There's nothing complicated about it. An organism enters through the skin or through the nose. There are local cells which ingest them, digest them, eliminate them, various methods by which these foreign organisms are eliminated. And because entry could be through any part of the body, these cells are present all over. However, many organisms will persist. They are more sturdy. They will overcome this initial barrier and they will actually establish themselves in the host, that is us, and start multiplying. At which time the messages are sent to various central organs in the body, where there is a message saying that, listen, there is an enemy, we need to get rid of this, we need more soldiers. So the cells multiply in larger numbers. They rush to the area of the infection and they try to deal with the infection. If this infection continues and persists and becomes systemic, that is, spreads all over the body, then the immune system is really at its full effort to contain the invader. So the second type of immune response is called we have an innate immunity and we have an active immunity. And these are very two distinct ways in which the body deals with foreign agents. But what is unique about the immune system is that it has this very unusual quality of recognizing every different infection it meets. And after it mounts an immune response against organism A, when the organism is eliminated, all these excessive cells all die out, but the body retains a small core population of cells which retains memory for that particular organism. And it does this for every infection that you get, A, B, C, D, E, F, G, H. And if after 10 years you meet A again, these memory cells are recalled and then they mount a very quick response. It doesn't wait for expansion. It quickly sends the soldiers out and it mounts a very, very vigorous response to eliminate A. The response against infection A is not going to work against infection B. So this ability to acquire memory, which is what we call immunological memory, and retain it for long periods of time is very unique to the immune system. And this is the basis for vaccination. So
Yeah.
all of us have a very good immune system, and it's lying dormant because it doesn't need to be used, but it has this huge potential to become active as and when it is required.
You nicely explained, Dr. Sita, how it helps to fight the infections, whether they are viruses or the bacteria. They not only set the foot soldiers there, it also retains the memory against that particular enemy, so that if that enemy shows up again, then you can actually mount a tremendous response to eliminate that enemy. What is the role of vaccines?
So basically, what is a vaccine? A vaccine is exposing the normal individual. Instead of getting a natural infection, you expose a normal individual to that infectious agent. But it is not in a state where it will cause disease. So you either inactivate that agent or make it non-pathogenic in nature, or take out certain parts of that organism which actually stimulate the immune response, and you inject it to a normal person. So if a child at birth is getting diphtheria, tetanus, pertussis, then polio, then you give them measles, mumps, rubella, all within the first year of life, right? Hepatitis B. So each of these is artificially introducing these infectious agents in a non-infectious state so that the child's immune response sees them and then mounts an immune response and retains the memory. So many years down the line, they actually go to school and get, this measles in the school, or there's mumps or something. The vaccinated child is in a position to mount an immune response and not get the disease. So vaccines are actually mimicking the immune response using the same structures of the infective agent, which is not in an infectious state.
Yeah. You mentioned measles, mumps. Measles, mumps, smallpox, polio, for example, they are the examples of very successful vaccines, and they have changed the infant mortality that we were so worried about, and that has helped improve the life expectancy over last so many decades. But at the same time, certain vaccines have failed. What do you have to say about the HIV, the SARS, the Ebola? How have they fared after a lot of effort was put in for years and years in their making?
Well, you can say that the success of a vaccine is related to how good is the immune response that is mounted during the natural infection. So even when you got smallpox as a disease, people who got it and survived never got it in their lifetime.
Yeah.
Or even for mumps or rubella, if you get the real disease, then the immunity that you develop is very robust.
Mm-hmm.
But you take something like, and when you are giving these vaccines, to make it acceptable to a mother to get her children infected, you have to guarantee that if not 100%, 99% of them of people will be protected. But you see what is happening with some of the newer vaccines, the influenza vaccines. They don't assure 100% protection because a natural disease itself doesn't give 100% protection. But we make compromises because we give them to adults. We are only assuring that your chance of getting winter influenza comes down from 100% to 80%. And people are willing to take that chance and take a shot, right? That I have at least an 80% protection. So because the natural immune response to influenza is not that robust. In the case of HIV, since the virus itself attacks cells of the immune system, we haven't found a way by which we can vaccinate the virus with anything that will actually help the immune response to mount an immunity, because the virus itself attacks the immune system. And we have even more complex situations. We have the amount of money that has been invested for vaccines for tuberculosis and for malaria, for instance. We have had very little success. So the less complex the organism, the easier it is. The natural infection is good, then it gives good immunity, the better is the vaccine. So those are some small guidelines by which we can go. In the case of the coronavirus, actually they did find a good vaccine for Ebola. Ebola vaccine has been a good vaccine. But the effort for the coronavirus and the MERS virus, unfortunately, since the public health intervention was successful and it was limited in its extent, the funding stopped and the efforts towards a vaccine sort of came to an end. I'm sure they could have found a vaccine if they had persisted, but we'll discuss that a little later. You need to have enough cases to try a vaccine, right? To see that it actually prevents the disease. So if you control the disease, then how do you even try a vaccine? So they reached that point where there was no disease, so they couldn't try a vaccine. So it just petered out. But it was not a wasted effort, because what we have learned from those experiences has really helped people in the current vaccine effort.
You just mentioned that the effect of generating the immune response by the disease itself is probably much better than the vaccine. But there has been a little funny situation in the case of COVID-19. At least, the initial impression is that there are lots of patients who, after a milder disease of COVID-19, they develop rather a poor immune response. And the IgG levels, when they were measured, they were not significant. They were either negative or sometimes in intermediate range. And unless you had a moderately severe or severe disease, you were not sure that your IgG level would pick up to a very desirable level. What do you have to say about that? So we feel that COVID-19 is behaving a little differently, and we don't know if the disease itself cannot mount a great degree of immune response in the form of a antibody. Then what might happen with a vaccine?
I think it's a new virus. We do not know much about the disease or it's only 5-6 months old. We don't have enough experience to really know the type of immune response it mounts, how long that immune response would last, what components actually provide a protective immunity. Will there be reinfection? So will the virus itself change like the flu virus does from year to year? I think our information is deficient. The results that we are seeing, yes, it does seem that the antibody responses are not always consistent. Not all the antibody that is produced is a neutralizing antibody. How long that will last and what will be the protection that it will provide, these are all unknowns. And that is why there has been now a lot of discussion of the T cells, because the immune response, which we talked about in general, consists of two parts: the antibody response and the cellular response. The antibody response comes quickly. It comes within maybe a week or 10 days. The antibody we need to look for are the IgG antibodies. And these antibodies, if they are directed against the actual pathogenic protein on the virus, they will neutralize the virus and prevent them from entering the cells and causing pathology. The cellular immunity develops a little more slowly, and they are very important, especially in viral infections. We don't have many examples where the cellular immunity alone, in the absence of an antibody response, actually gives protection. But we may be dealing with a new kind of a virus. We really don't know. We are still in that learning phase.
This
it's
is
a very steep learning curve, but it is a learning phase.
This is a very unexplored area. Dr. Sita, what do you think about this Russian vaccine? Now, this is of sudden interest since yesterday,
Yeah, we do
where
have
the
a
prime minister
question
of
from
the
a
country.
video also. They
Yeah.
want to
Oh,
know.
yeah.
Yeah, they are. I'll just read it for both of you so that we can come
Yeah.
up with this topic. That
Yeah.
all the countries have been talking about the vaccine coming out end of this year or beginning of the next year. How optimistic are you? Do you think that everyone will be able to get the vaccine easily once it's ready to be distributed? We are in phase 3 trial of the vaccine, whereas Russia already claimed that they have the vaccine ready. Is it safe to take it without completing the scientific trials?
Yes,
Well,
Dr. Sita.
yeah, the WHO site updates almost 24 to 48-hour basis. The last update is on the 10th evening. There are 6 vaccines in phase 3 trials. That is phase 3 approved. 3 of them are from China, 2 of them are from the US, and 1 is the Oxford vaccine. Now, when we say approved, means the regulatory bodies have given sanction to perform phase 3 trials. And phase 3 trials, for instance, for the American vaccine, they're going to recruit 30,000 people as per their protocol. And they have so far only recruited 10,000. So recruitment, you are going to, ultimately, you and I are going to take it. We are going into the community and we are going to immunize these millions of people. The safety is paramount. If you're going to inject a whole lot of people with something foreign, and as you said, the antibodies are not produced, or it's not as effective, or it causes some kind of side effect, even in a small population, a small number of people, it's disastrous. So you have to be absolutely, there is no shortcut. It is ethically not correct not to go through the proper trials and assure everybody that there is nothing will happen if you take this vaccine and you will get protection. Now, we are not in that state. And I don't think anybody is talking about a vaccine before maybe early 21. And that too is a very, very optimistic, it's like if everything goes right and nothing, there's no slip ups along the route and so on and so forth. The Russian vaccine is a different story. I think their regulatory processes may be different. In their own statement, they say that they have approved the vaccine, but they are going to start the phase 3 trials this week. So what does that mean? US FDA would not even look at a protocol they have to approve the phase 3 trials, and they wouldn't even look at
Yeah,
the protocol
they,
unless every piece of scrap of paper was there. They have they have made some compromises. Conventionally, a vaccine would not be considered good unless it gave protection to at least 70 to 80% of those who were vaccinated. But they have made a compromise, and they have declared, the FDA has said that they will make 50% protection acceptable for the COVID vaccine. So you can imagine how desperate we are for a vaccine, that the FDA should have brought it
yeah,
down from 80% to 50%.
yeah,
But you have to show that it is effective in half of the in vaccinated people. And that means that you have to expose 30 of, 30,000 people to the vaccine. Then you have to wait for them to get infected and then make sure that there is protection. The only good thing I can see is, and that is unfortunate, that since a lot of vaccines have a problem, that by the time the science is done and you reach the trial stage, the incidence level of the disease itself is so small
Yeah.
that it's very difficult to show statistical significance between vaccinated group and the placebo group, because you don't have enough
that's the
number of
problem.
events.
Yes,
Yeah, it
yes.
happens. But here, unfortunately, that is not the problem, because we have enough infections. So probably in the next couple of, they're not going to disappear. But yes, but the Wuhan vaccine, for instance, by the time they came out with the vaccine, they didn't have enough cases. So they are going to do their trials, and they have started their phase 3 in Brazil.
In Brazil, yeah.
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 Uh,
So
the Russians, I think there's been a lot of political pressure. There has been a lot of political
I mean, I
pressure
think,
in
yeah,
the US also, and they want the vaccine out as soon as possible. In fact, the election is coming, so they are very keen that if the vaccine could be given to all Americans, that's probably is going to change the face of the election. But uh, this looks more like a sensational news from the Russians rather than anything else. If you are giving your approvals on the basis of injecting 76 volunteers only, and then telling the world that we haven't had problems with them, and let a billion people be vaccinated, or 10 billion people be vaccinated around the world based on that, that is not going to happen. And so they would run into various types of problems, though we have found that some countries have been in touch with Russians. At least the foreign minister of Russia has announced that, and the trade minister also, that there are several countries who are willing to kind of join hands with them and accept the vaccine. So they are going to go for a mass production of 500 million doses. Now, I don't know, desperation is gone to that extent because you just want to do something for to contain the spreading virus. But however, I don't think this Russian vaccine is going to become popular. There was also another question that whether India should be a part in production of the mass production of the Russian vaccine. I doubt if that's going to happen, because you can have a, emergency use authorization for a drug much more easily than you can have it for a vaccine, because the drug is going to be used in a very serious situation, very probably in dying situations. For example, I'll give you examples of convalescent plasma or remdesivir. But vaccine is something which you're going to give to normal
no,
population. You
yeah,
just cannot give to a normal population and then realize that it is causing the disease, it is causing some kind of reactions which are difficult to handle. So there are lots of things in phase 3
well,
trial.
in
uh,
India is a big center for vaccine manufacture. It produces, say, 70 to 80% of the world's vaccine requirements. But I think most of the major vaccine producers have already committed to making the various other vaccines, the Oxford vaccine and the Boston vaccine, and they have already had tie-ups. There are 2 Indian vaccines on which are going to enter phase 3. They are in advanced phase 2. So I doubt if they have the capacity now to manufacture the Russian vaccine. And I haven't heard of any formal agreements by which Russia has approached India for
Yeah,
manufacturing.
no, yeah, there's no formal agreement with Russians.
Yeah,
No,
yeah.
no, not so far. Rashmi, more questions from you,
Yeah,
please.
I am getting a lot of questions, and people do have curiosity, and they want to know about the reopening of school. Like in few countries, they are or reopening the schools. The most important thing on parents' mind right now is the reopening of school, keeping in mind the safety of the kids and the teachers. What are your thoughts on school reopening today?
So as
Rashmi, okay, let me just answer that quickly. Luckily, in pediatric age group, the disease is mild. Uh, and the mortality rates or rates of serious sickness have been very low. So that is a very big plus. There is a worry about children who are less than 5 years old,
Mm-hmm.
but still that number is also compared to adults is much less, and that is not the school going age. So in
Yeah.
school going age, luckily the disease is very little. So those cities within a country. So let me not talk about the all states as a whole.
Yeah.
Same goes for India as it goes for the US. That where the disease is cooling off, there is like they are doing in the UK now.
Mm-hmm.
They have started the opening of the schools, and the disease is still there. It's not gone,
Of
but
course.
they are taking calculated risks and going to ensure that there is a safe distance maintained within the classrooms. And though the children, what I'm aware of is they're allowed to play in the schools, but apparently they are taking a calculated risk, and it's in, of course, consultation with the families and the parents. So I think where the disease is cooling off within the country in those states, it is about time after the summer break that the schools could be allowed to function and then observe. If there is a little bit of an outbreak somewhere, then they can always take a retrograde step.
Of course.
Dr.
And for
Sita?
Dr. Sita, they want some tips for for immunity, like how and what they should do. And is yoga effective? What is your call on that?
I know this is a common kind of um, feeling or something that has got caught on in society. This issue of immune boosters, and you eat this and you do that, and your immunity is boosted. But as I said, that the immune response is very specifically against a particular agent.
Mm-hmm.
All of us have good immune systems. Unless you are taking a drug which suppresses the immunity due for some other disease like an anti-cancer drug or steroids for an autoimmune disease, or you have some kind of disease which itself compromises your immune system. Um, your immune system, all of us have a good immune system, and it always responds very well when you are faced with a problem. So if it stays at 100%, you can't make it 110%,
Of
right?
course. Of
If you do yoga and you eat healthy, you will feel better, and your immune system will continue to be effective and efficient. But it's not that you can misuse your body and then eat healthy, and suddenly you can compensate and make the immune system, be pulled back into normality. You
of
have to
course.
treat it with
Of course.
treat your
Yeah,
body with respect.
Dr.
Yeah.
Kavar, I have a question for you
yeah.
also. They want to ask, what are the long-term side effects of the pandemic? Does it have a permanent damaging effect on some organs? And one more question, you
Uh,
can combine it. You deal with COVID patients. Do you think COVID does not seriously impact the young generation?
it does, but in much smaller numbers. We have seen mortality in young also, and but over the last couple of months, uh, we have not had a young person actually dying in our hospital.
Mhm.
We did have a few people who couldn't save, but that was way back in late March or April, and I think from May onwards we were handling them pretty well, and just because they tended to, through their own immune response, were able to handle the problem much better. We have had more problems with diabetics, hypertensives, and those people who have had comorbidities like a chronic, a long-standing, well-known, established heart disease,
I think
with or
obesity
without heart
also is.
failure. So, and obesity also. So
uh,
these are the risk factors which, if are there, even in relatively younger people, means less than 50 years of age, it can again be troublesome. Now, coming to your first question
Yeah.
about the long-term effects,
Uh-huh.
uh, we call it long COVID.
Yeah.
In fact, I'm writing a chapter on long COVID in our textbook. This is a definite entity whereby the acute phase of the disease is over, but some kind of weakness, tiredness, fatigue lingers on, lingers on for months. And we have had patients where even after 3 months, the patient says, "I'm not what I used to be." Some people have a chronic little bit of cough, not much, a little bit of cough, which can go on for a couple of months. Some people actually develop psychiatric problems, anxiety related problems, and some people, we haven't had people, affected with COVID having joint pains, arthralgia, we call it, arthritis. Arthralgia means where there is joint pains without any limitation of the movements. So we haven't had patients with that, but certainly uh, some people had diarrhea, which a little bit of abdominal discomfort, which went on for a few weeks, but usually settled. So the most common symptom has been the physical conditioning for them, which has been a little difficult. Some of them feel I just can't get out of the bed, I can't get out of the house, I don't feel like walking. So when you have these things happening, even after 2 or 3 months of the apparent cure, the patient is COVID negative, RT-PCR is negative, then we start to do the rehab process for them, gradual, graduated, increase in their exercise program. Not suddenly. Some of them, they try to do a more vigorous exercise, they end up being worse. So graduated exercises in those cases, and of course, nutrition has to be good, well maintained. So these are the things which we look at and we are facing.
Okay. So, hello, I think so. Yeah, you're good. Okay. All right. And one last question I'll be taking. She's watching this show. She's asking. She recently heard from someone that blood group O has not that clear symptoms of COVID. Is it true? People with blood group O,
Right?
the
Yeah.
symptoms of COVID are not that clear. Is it true? She's asking.
I think this is a kind of, yeah, there are some studies which, I mean, this is a kind of a retrospective analysis of patients who have been tested positive, and statistically, it has suggested, I mean, there is some suggestion that people with blood group O may, I mean, there were fewer people with blood group O in the severe category than not O. But these kinds of studies have their own um, uh, limitations. It's not that if you go into the hospital and you are blood group O, you will not fall sick or you will not get severe disease. These are sort of statistical analysis which
Yeah,
show that maybe
these
we
are
are a little bit better protected.
these
So
are
I don't think
stats.
one should take it as a that if I am an O, I can relax, I will not get COVID. It doesn't affect
Yeah,
individuals.
Okay.
It is a larger study.
yeah,
Yeah.
yeah. I agree with that. Yes, absolutely.
It is, of course, a worrisome situation, but of course, as you're on our show and you have shared so much with our viewers, it's going to be a great help, Dr. Cover, right?
Yeah. So I think we're coming towards the end of the show. Rashmi, if you don't have any more questions,
No, this is all, and a few of the questions you already covered, Dr. Cover. So there was already in the conversation. They'll watch the show and they can have the answers. So I'm not taking those questions. So thank you, viewers. It was
thank you.
great, and Dr. Cover, thank you for being the co-host, and thank you, Dr. Sita. It was
Thank
great to
you.
have you on our show. Thank you so much.
Thank you, Dr. Sita.
So much.
Thank you, Rashmi.
थैंक यू,
It's been a pleasure.
थैंक्स व्यूअर्स। मैं हूँ रश्मि बेदी। हमें उम्मीद है ये शो आपको पसंद आया होगा। लेटेस्ट वीडियो के लिए देखते रहिए माय ड्रीम टीवी USA और पसंद आने पर लाइक, शेयर और सब्सक्राइब करना ना भूलें।